I had a long journey to get here. I had oral cancer. I had the cancer removed, which also included all the skin in my mouth. All the teeth are on top of it. They did a skin flap where I took skin off my arm, put that in there, replaced the tissue that was there. As nervous as I was, I did see my general practitioner, and he said that I was very, very fortunate that I had two world-class surgeons working on me.
William presented probably over a year and a half ago, and he had just come out of surgery to remove a tumor in his jaw. And in doing so, the surgeons that I work with, the microvascular surgeons and head and neck surgeons, had replaced part of his jawbone with part of the leg bone. And that's routinely done. However, what's not routinely done is reconstructing patients with leg bone as part of the mandible, the lower jawbone. So William presented with a complete lack of dentition, no teeth on the entire lower left side of his mouth, a very large plate that was holding in the leg bone attached to the jawbone. And he went to approximately 19 doctors, all of which to a person said, "We can't treat you."
Benjamin Kerr took a look at me. I had been to 19 or 20 oral surgeons since I saw him first. He was the first one that said he could do it. Either I heard I wasn't a candidate or that they were not willing to take the risk and work on my situation.
When William presented to us, what we specialize in is graftless solutions that we believe are easier for the patient to tolerate with less morbidity. And we're talking about a patient who already went under surgery to remove cancer and to reconstruct his jaw. So we want to do the least amount of surgery possible to achieve the best result. There's a tumor board, and patients are presented at a tumor board, and it goes from pre-op to op and post-op, and we're part of that. So all along, it was proposed to him that he would eventually have teeth. He would eventually have dental implants.
After walking around with no teeth on the bottom left of my jaw for a year and a half, the work that Dr. Kerr and Dr. Vargas have been able to perform on me and get me to this phase has been incredible. The pieces are handmade. And, I was telling I said, "You must have been really good at arts and crafts." Because as I'm rolling my tongue in my mouth, the distance, the height, and everything is amazing.
Through technology that we've been implementing over time, as well as experience, we were able to reconstruct William by placing 4 implants in the leg bone, as well as placing an immediate bridge at the same time. So William came in without teeth and left with teeth for the first time in years. And that was a extremely rewarding case.
I was very confident that I'd be fine. The confidence that Benjamin Kerr and John Vargas had were very reassuring. I have all the faith in the world that it was going to work out fine. Same thing I did with the first surgeries. I'm in good hands.